We are back now with today's checklist. October is Breast Cancer Awareness Month, and yesterday we focused on spreading awareness. Well, today we're talking about treatment.
Joining us now is Dr. Marisa Weiss, oncologist, survivor, and founder of breastcancer.org. She's sharing the latest advances in breast cancer care to help us take control of our medical treatments. Good morning to you.
Good morning.
Good to see you. So when someone is diagnosed with breast cancer today, let's talk about maybe some treatment options that they should be talking with their doctor and discussing with their doctor.
Well, the good news is that there's so many new medical advances and there's no one size fits all. Clinical trials is the way you get access to the latest therapies before they become widely available. This is not a last resort. You're not a guinea pig. Ask your doctor if you've been diagnosed. Am I eligible for a clinical trial?
The guidelines always seem to be changing. Yesterday, we focused a lot on genetic testing. I did my genetic test yesterday, sent it off into the mail. But for women under 40, is there anything they should be considering at that age?
Well, it's so important you ask that question because more women are being diagnosed with breast cancer at younger ages, under 40, for whom there are no screening tests right now. They're not getting the benefit of early detection. At breastcancer.org, we let people know that there's this new, really important phenomenon. We can't ignore it. Young women in the prime of their lives need the benefit of early detection. You want to be able to get genetic testing because that helps us pick the best treatments for you. And it also helps assess your overall risk so that we can keep you safe over time. And genetic testing is not a big fancy thing. It's just a tube of blood or you spit into a sample and send it off.
But it is expensive.
Well, it's usually covered by insurance.
Oh, okay.
Yes.
So before I get to something else, I'm just curious, do we know why younger women are being diagnosed so much earlier now?
Well, we don't know all the reasons why, but we know that most breast cancers don't run in families and that it's related to how you lead your life, what goes in, on, and around us, and how your inside environment interacts with the outside environment. All those things that you do, in your everyday life, plus, the alcohol consumption that people are drinking more, they're exercising less, they're not sleeping so well, they're not, they're eating junk. There's a lot of reasons why altogether the risk may be increased.
So to that point, doctor, what are some of the things that women can do beyond the screenings and things like that to help bring a better outcome?
Absolutely. You know that most serious diseases are related to how you lead your life, what goes in and around you. That's for heart disease, that's breast cancer and other things. But you got to do what you can to control what you can. So breast health equals women's health. The same steps: getting to a healthy weight, exercising regularly, following a Mediterranean diet, limiting alcohol use, stop smoking, sleeping well, manage your stress. And that's a lot, right? It's hard work.
Sure.
You got to start somewhere, right? So exercise is a great place to start. And once you do that and you do well at it, you're more likely to do something else.
Well, you're not only a doctor, you're a survivor.
Yes.
I think sometimes when you hear the C word and you get the diagnosis, it's just scary.
It turns your life upside down.
So is there any advice or any wisdom you could share?
Yeah, well, I got that call. I got breast cancer, and I became the dual citizen, both a doctor and a patient. And I can tell you that I had the best care possible, but there were still major gaps. And that's why I started breastcancer.org, is to help people get the best medical expertise and support they need so that they can make the best decisions for their lives. I mean, it's not just your life. Everyone depends on us for everything, right? So, breast health equals women's health.
That's good. So great.
Dr. Weiss, thank you so much.
Thank you so
Appreciate
much.
That. Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.